Melasma explained, what it is and how to treat it properly. Melasma may look like simple pigmentation, but if you treat it like ordinary sunspots, you can actually make it worse. Melasma is not just excess pigment. It is a chronic condition involving pigmentation, inflammation, and vascular factors, which is why it usually needs a structured medical approach. This is also why many quick treatments fail. What is melasma? Melasma usually appears as symmetrical brown or gray-brown patches, most commonly on the cheeks, forehead, upper lip, and sometimes the jawline. It is driven by overactive melanocytes, but also influenced by UV light, visible light, heat, hormones, and inflammation. Importantly, melasma is not simply surface pigment. There is ongoing skin activation underneath, which is why simply removing pigment rarely works long-term. Why melasma is difficult? Melasma is chronic and relapsing. Even when pigment improves, the underlying triggers may still remain active. Without maintenance, recurrence is very common. One of the biggest mistakes is treating only the visible pigment, without controlling inflammation and melanocyte activity. Step 1. Photoprotection. Treatment always starts with strict photoprotection. Broad-spectrum sunscreen is essential, but visible light protection is also important, especially in darker skin types. Heat can also aggravate melasma, which is why some patients worsen despite using sunscreen alone. Step 2. Topical therapy. Topical therapy is the foundation of treatment. Hydroquinone may help reduce pigment production. Retinoids help increase skin turnover. Other pigment regulators may also help suppress melanocyte activity. Glycolic acid can sometimes be added as support. It may improve skin turnover and penetration of active ingredients. But glycolic acid alone does not treat melasma, and excessive irritation can actually worsen pigmentation. Step 3. Chemical peels. Superficial chemical peels may help selected patients, especially epidermal melasma. Glycolic acid peels are commonly used, but aggressive or deep peels can worsen melasma through inflammation. This is why careful patient selection and skin preparation are important. Step 4. Devices and lasers. Devices are not usually first-line treatment. In resistant cases, low-fluence 1064 laser toning may sometimes be used cautiously as an adjunct. But aggressive laser treatments, or IPL, may worsen melasma, especially when excessive heat and inflammation are generated. This is one reason why proper diagnosis is critical before treating pigmentation. Step 5. Maintenance. Melasma requires long-term control, not a one-off cure. Maintenance usually involves ongoing sun protection, topical therapy, trigger management, and realistic expectations. Patients often improve significantly, but recurrence remains common. Step 6. Tranexamic acid. In resistant melasma, tranexamic acid may sometimes be considered. This may be used orally or topically in selected patients. Tranexamic acid may help reduce melanocyte activation and vascular signaling involved in melasma. However, this is not suitable for everyone. Oral tranexamic acid may carry risks including thromboembolic complications, headaches, gastrointestinal symptoms, and possible menstrual changes. Careful medical assessment and risk screening are essential before considering oral treatment. While studies show promising evidence for resistant melasma, recurrence may still occur after stopping therapy. This is why tranexamic acid is usually considered part of a broader long-term management strategy. Melasma is not just pigmentation. It is a chronic skin condition involving multiple pathways. Successful treatment is usually about control and maintenance, not quick fixes. If you are a practitioner, nurse, injector, or skin therapist, comment below with your experience managing melasma. What treatments have you found most effective? And what complications do you see most commonly? Subscribe for more evidence-based skin and aesthetic education. To learn more, visit the main ASI website for courses, workshops, and clinical education resources.